Hi, you guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, Q banks, one-on-one sessions, and question analysis sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. Y'all, I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. On top of that, today is my NP-versary. Look, we're heading up into 10 years. That's crazy to me. But anyway, and you will see some things for celebration for that, but I'm not even going to get all into that in this video. But y'all, we have been doing this since 2015 with a 99% pass rate on all of our courses and a 100% pass rate on one-on-one sessions. I have really been going at it, trying to approach things on things that I wish I had. So I hope that you have been finding this helpful as you're preparing, studying, and even as you're practicing. And I thank y'all for all of y'all's feedback and encouragement and support. It really does not go unnoticed. Now, y'all know I always like to go over my disclaimer that we know there's no absolutes in medicine. We treat on a patient-by-patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP. Now, any of my videos where I'm teaching on things that we currently do in practice, I'll always say that so there's no confusion, okay? That being said, let's get into our questions for today. All right, again, updates. Our practice question course is coming up November the 2nd from 10 to 11:30 a.m. Eastern Standard Time. And if you would like to get the recording instead, if you're unavailable, let me know. It will only be available for a small period of time, as live and recording is two separate things. So I try to keep it fair for everybody. But again, it'll be November 2nd from 10 to 11:30 a.m. Eastern Standard Time. We work through the exam breakdown for the ANCC as well as AANP so that you understand, have an idea of the blueprint, know what to expect, know the percentages of system-specific questions. We go through practice questions live together for each system so that you're able to kind of gauge where you are and to see how this may look for each question type. I teach you how to answer each question type. I give you test taking tips, and then you will also, at the end of this, get the questions that we have gone over, as well as the tips that I will be going over with you guys with. There's only 10 people because I like to keep it small so that I can interact appropriately and help you as needed. And we are down to 6 availabilities left. So if you're looking to join, you better grab it while you got a chance. Don't say I didn't tell you. And then our antibiotic worksheet and diabetes worksheets, they are linked in the description. And you can also find them on my website. If you don't see it or you're struggling to find it on here, just go to my website and you can see it linked there. The antibiotic worksheet is $12.99. The diabetes worksheet is $14.99. The antibiotic worksheet goes over the primary antibiotic drug classes, the common medications that fall into those with the endings, common uses, mechanism of action, and contraindications, all on a chart to make it easy for you to study and review, as well as if you need it for practice too. And then the diabetes worksheet goes through, the criteria to diagnose, understanding prediabetes versus diabetes and what criteria falls in each of those categories, how to manage and treat those with the included medication classes and its uses. Okay. So just trying to give you some tools to make some of these things a little bit easier to navigate and review, because I have heard you. And those areas that you're struggling, I'm trying to give you the tools and resources to make it a little bit simpler. All right, you guys, but with that being said, let's get into our questions for today. Question number 1 states, the nurse practitioner is planning treatment for a newly diagnosed diabetic patient with an A1C of 9.5%. What is the best initial treatment at this time? Is it A, initiate metformin, lifestyle modifications, and consider insulin therapy? Is it B, lifestyle modifications only? C, refer to an endocrinologist immediately? Or D, insulin therapy? Take a moment and tell me what you got, you guys. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is being asked of you. So here, the stem of the question states, what is the best initial treatment at this time? Number 1, I always tell you, if they're looking for a treatment, you need to run it back and see if they have provided you with a diagnosis. And if they have not, you need to run it back a step further to look at those assessment findings so that you can come up with a differential diagnosis and determine how you need to move forward and treat that particular diagnosis, right? But also here it asks for the best initial treatment. So we're looking for first line therapy and the best first line therapy option based on this scenario, right? So it does tell us this is a diabetic patient. So we do know a diagnosis of diabetes, and the patient has an A1C of 9.5%. So how are we treating somebody with not only diabetes, but newly diagnosed with diabetes that has an A1C of 9.5%? So your best answer is going to be A. You want to, our first line medication therapy, because they definitely need medication to initiate metformin. We want to make sure we incorporate those lifestyle modifications. And they're right on the cusp of when we typically would initiate insulin therapy, because an A1C of 10% is when we typically incorporate insulin therapy as the management. As this is newly diagnosed and we're not at 10, you want to go ahead, give them the metformin, do the lifestyle modifications, keep the insulin therapy in mind that we may need to go that route at some point, but you want to see how they respond to the initial therapy that you're going to give, have them back in 3 months, evaluate, see how they're doing, and then proceed if needed, okay? Question number 2. The nurse practitioner and NP student are discussing foot assessments for diabetic patients. Based upon the American Diabetes Association, how often should diabetic foot exams be completed? Is it A, only when symptomatic, B, when diagnosed with diabetes and annually after, C, only if there's a neuropathy diagnosis, or D, every 5 years? What do you think? All right, so stem of the question here states, based upon the ADA, how often should diabetic foot exams be completed? That stem tells you everything right there. But you can look back and see they're simply the nurse practitioner and NP student are discussing foot assessments for diabetic patients. So how often should we do this? The best answer is B. When they're diagnosed and annually every year after. Annually after. Why is that tearing me up so bad? Every year after, because annually and every year is the same thing, but you get what I'm saying. When we diagnose them with diabetes, you want to do a foot exam then, doing your monofilament test. And then every year you want to do a foot exam, okay? Whew, that was whipping me, ain't it? All right. Lastly, question number 3, y'all. The nurse practitioner and NP student are discussing when to obtain the next A1C level. Patient is meeting treatment goals. When is the appropriate time to assess his A1C again? Is it A, every 3 months? B, every 6 months? C, annually? Or D, he's meeting treatment goals, so no further A1C levels are needed? Take a moment and tell me what you got. All right, so reading the stem of the question here states, when is the appropriate time to assess his A1C again? All right, so this patient is meeting treatment goals, and they're just trying to determine the next A1C level. A diabetic patient who is remaining in the target goal range, their A1C should be monitored every 6 months. Okay? If they are uncontrolled, remember we talked about this the other day, it's every 3 months, right? So don't get those mixed up. Make sure you're paying attention to how they are wording the question so you're not getting tripped up, okay? All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to thenursingstudio1@gmail.com. The things that I do offer are my review book. Both the ebook and paperback option are linked in the bio of this channel. The self-paced review course is also linked in the bio of this channel. So if you prefer to study independently on the go, that's an option for you. It's linked in the bio of the channel. If you need practice questions, my QBank options are linked there. And then if you're looking to book any one-on-one sessions with me, I always say call, text, or email so that we can adequately gauge which one-on-one option is going to work best for you as they are customized. All right, you guys, as always, make sure y'all meet me back here. Happy studying. Bye, y'all.